Please join me in welcoming the moderator, Barbara Ficarra.
So I am actually going to just give a very brief, quick overview of what the panel will be discussing. The panel are the experts today, and they will be talking about social media and healthcare, and I will just quickly go through a brief overview. So healthcare today is rapidly changing. The landscape of healthcare is changing and the communication process is changing because of social media. Pew Internet and American Life Project states that 59% of American adults are searching online for health information. So patients and consumers are out there in the space engaging in social media, whether it's Twitter or Facebook. And not only are they involved in the social media networks, but they are also in communities online as well. There's Inspire.com, there's Patients Like Me, there's these communities where these patients are actually going to vent and look for emotional support and having conversations, real-time conversations, and they're engaging and looking for support. So social media is just exploding. It's exploding with patients and healthcare professionals, from physicians and clinicians and nurses. And healthcare is just all about the patient today. And not only are we talking social media in terms of Twitter, Facebook, blogs, things like that, it delves more into technology too, from texting and telemedicine, telehealth. Dr. Kivadar from the Center of Connected Health talks about a lot with texting and how this one dermatologist is using it to provide little bit of snippets of information for his patients. So it's really just about engaging. Patients are out there and we're trying to engage with them. And these are just some of the questions that we'll be kind of focusing on today. But for right now, we will leave, Wandia will actually introduce herself, and then she will come up and just give a brief overview of what she's going to talk about.
Such an honor to be here, and truly a pleasure. This is a space that I'm really excited about and interested in. I started out in the sales and marketing divisions of pharma companies, Medtronic and Eli Lilly, and then I went off, started my own digital marketing company because I always thought this was really fascinating. We sold that in 2010, and then since then have been doing a lot of consulting with consumption, mostly consumer-oriented companies, did a little bit of stuff with pharma, and then now I'm back at Johnson & Johnson doing digital marketing there. So it's kind of interesting because on the consumer side, there's this fast pace, the focus is on the consumer, the focus is on, how can we engage people with technologies, and we don't have the same challenges that healthcare does of overlaying that with regulation and privacy and compliance and legal. And so on one side, we have that type of infrastructure holding us down, and then on the other side, we have the patient, the ever-demanding patient that is saying, how are you serving me? How are you connecting with me? How are you understanding my needs? How are you engaging with me on social media? So I totally recognize that that's the environment that we're working in, and we're going to try and address some of that today in the follow-up panels. Out of curiosity, how many of you, so that's what I'm going to go through, the trends across social media platforms, how patients are using social media, and then some important questions and considerations that we should be thinking about. So out of curiosity, how many of you are on Facebook? Wow, interesting. How about Twitter? Anyone seen a YouTube video or does that pretty frequently? All right, so as individuals, we are using these platforms. We're personally familiar with a lot of these platforms, right? We know that Facebook now hit over 1 billion users. Twitter, you have people signing in, over 50 million people are signing in daily, and a lot of them are also using third-party tools and platforms to tweet and get real-time information. Pinterest recently became one of those platforms that's driving massive traffic towards pretty much anything. And I don't know how many of you are using it professionally. Just out of curiosity, professionally, so not that many. How about personally? Browsing for information, looking at recipes, clothes, outfits, that kind of stuff? Okay. So actually, when we're looking at the data and trends, Pinterest is really amazing at actually driving that point of purchase. Google Plus, we've been seeing a lot of hangouts where people have live stream events and discuss things, so holding conferences and live streaming events. And then Instagram is like so popular with especially the younger generation, but I think everyone is kind of picking it up. Curious how many people are using that? Okay, all right. Well, so generally, like the challenge has been how us as, I think in healthcare or in finance, I did some work with Goldman Sachs as well. In finance, there's kind of been that, there's the legal implications. A lot of people are more restrictive in terms of how they use this, but the consumer, on the other hand, is very much sharing this information on these platforms. And as a marketer, as a marketer in healthcare, I've been very obsessed with where the consumers are using these platforms, as well as how they're using offline technologies and how we can optimize that to save costs and to actually increase that patient satisfaction level. So I've done a lot in diabetes care, which has been my focus. And in type 1 and type 2, I've been looking at the data and the analytics behind how patients are interacting or getting medical information. And this kind of shows some of the places that they're looking at for information. They still really do trust their physicians and their certified diabetes educators to give them information. And we're going to see later on, my fellow panelists will talk about kind of the amazing trends that doctors and CDEs and other types of healthcare providers are using to reach out to consumers. But you're also going to see that people are using blogs to get their information. They're using friends and family members, which is also a lot on social. They're using online chat and communities and reading their newspapers and magazines off of their tablets and off of their phones. So few people now are actually getting real information from TV and radio, which is kind of fascinating. Traditionally, 10 years ago, who would have thought that switch would have happened, right? I mean, 10 years ago, who was on Facebook? Who was on Google? And the crazy thing is, many of us don't know how we live without Google to find our information. So this is some of the trends in terms of how patients are using medical information. Now, one other thing to think about, I'm just going to kind of go back to that, is that today, social and mobile are the way that that's what's currently driving viewership. And I think that this is just the beginning of a trend in which the world is moving so much faster. And as we think about where we're going, we're not so much stuck in the technologies that are there, but focused more on how what people's needs are and what those technologies should be. And so as we think about our digital strategy, it has to have 4 key points. 1, what's the strategy, or what are you trying to achieve and accomplish? And you have to be really focused on that because the technologies will shift. 2, what are the processes? 3, who are the people who are going to implement that? And 4, what's then the underlying technology? So let's not get so stuck on the technology or the products or the campaigns or what we're trying to drive, but what are the needs that we're really trying to meet efficiently, effectively, and cost effectively? And then we can lay on the technologies, the people, and so it starts with the strategy. It starts with, okay, where am I going? Then what can I choose to take me where I'm going? And some of the questions that a lot of people are asking are, especially from the healthcare side, how best can we ensure patient safety? How can we evaluate efficacy? Are we doing a lot of activity that's not actually resulting in any type of real outcomes that are part of our overall strategy? How do you influence what patients care about? How do you make sure that patients are talking to each other? And are there new reimbursement models that we can look to that could enhance care? And my panelists will talk about that. How do you make sure that patients are learning and ultimately having the behavioral changes that you want that showcase the type of clinical outcomes that you're interested in? And how can social, that becomes the last question, how can social help you meet those needs? So some of the examples in terms of how social is helping us reach our goals is they become good platforms to help promote exercise, wellness, and community. They're helping to drive participation to offline events like Tour de Cure and a lot of different offline events, taking care of your diabetes. I'm very focused mostly in the diabetes side. How do you sustain and strengthen engagement over time? Social platforms can become really helpful for that. And for some of this, like promoting exercise and wellness or driving participation, the more famous platforms like Facebook and Twitter can be helpful because that's where we're acquiring the patient, or that's where we're reaching the patient. That's where we're like bringing them into our funnels and then taking them into our patient forums. So because of patient privacy, we're finding that, you know, that kind of more outward facing, very public information is not driving it, is not the place to play, but those become a great place to kind of bring in the patients into your funnel and then take them on forward. Other ways is that social is helping us develop better reimbursement incentives for care, community, and participation. Social has been amazing at helping drive communication among patients and then between patients and providers that eventually lead and influence those behavioral outcomes and clinical outcomes and behavioral changes that we need. So you'll see a lot of stuff that's going on that's really exciting: gaming, real-time communication, social and mobile, and the technologies that are available now are really helping us achieve outcomes that we couldn't have thought of 10 years ago. We're also using social and mobile to help drive outcomes, reminding people when their doctor's appointments are coming in or their prescription refills, and I'm kind of excited because more of that is coming up. And then with communities, we're finding, particularly with chronic illnesses, community can become really helpful because a lot of providers now have less time to spend with patients, and yet that peer-to-peer interaction can be a huge influencer in driving the type of outcomes that we want. Then finally, for us in pharma and biotech, I hope I haven't lost half the crowd by saying that, we want to be able to push our company views and news and that type of information, which could be helpful because every other industry, the manufacturer is actually well respected. I go to Ford to learn about my Ford car. I go to Toyota to learn about how Toyota works. And we hope that pharma can become a lot more credible in terms of how they relay information to providers. And you say, yeah, this is actually stuff that helps me use your product better, and that helps me ultimately help patients and get reimbursed for it. All right?
Christina? So my background is in hospital administration, and I also had a hat. In hospitals, we tend to wear multiple hats, so one of my hats was risk manager. So in the back of my mind, I'm always thinking about the risk. And a lot of times the questions that come up around social technologies involve risk. So I think through those things. Those are the kind of things that sort of keep me up at night. But on my background, I started as a hospital administrator and then got involved in a RIO, one of the very early RIOs, which is no longer around anymore. But I think the lessons learned survived. And the beauty of that specific project was it opened my eyes to the power of technology. So from that experience, I started my own blog. And then I got tired of all my friends asking me, what's a blog? Why would I want a blog? And so I wrote a book on use of social media, specifically for healthcare, because the whole time I was blogging, I was thinking about how do we apply this tool. So I thought about HIE, then I start thinking, how do we apply these social tools to healthcare? And then I kind of went on this little telemedicine thing, figuring out how to incorporate that. And now I'm working with Tower. And what we're doing is, again, from this patient experience perspective, is we're trying to tie all of those technologies together because they all have a very important role from not only the patient's perspective, but if you look at the other audience groups, you've got the staff, you've got the physicians, you've got the community at large. So that's how I've kind of wound up at this point. I, again, come at this topic from a very practical, operational orientation, and I'm a little bit afraid of the technology, and I think we all should be a touch afraid, and that's what's going to keep us out of trouble, because if we're a little bit afraid, we're going to think before we post. Hopefully. Hopefully.
Um, and I'm sorry because I forgot my little reading glasses, so I've kind of drawn a little bit of a blank on my notes. No, I'm okay. I'll kind of get through it. So this slide you saw a little bit earlier if you were in the portals presentation. And what I want to point out on this slide specifically is what we're really talking about in this particular session. It is the patient-empowered portal pieces. This is really where we're going to start seeing social coming into its own. So when we say social media, probably the first thing you think about is Twitter, Facebook, Pinterest, all of the other brands. And what I've done, and social media has sort of come out, and the first place it found a home in healthcare was marketing communications. And that makes pretty great sense. It's easy, it's low risk, so people can kind of put the feed in, test it out, see how it works before you go start worrying about connecting with patients on social media. So I've gotten beyond the brands and I think about the technologies, because as much as I'd like to really go on Facebook and have a support group with other people with the same diagnosis, that makes me a little afraid. And the data shows that patients would prefer to have an integrated approach with their hospital website and social opportunities for them to network. I trust my hospital. That's why I selected the hospital. I kind of would feel a little bit more secure knowing that they're making sure my information stays private rather than Facebook. I remember having, when I was working with the telehealth networks, we asked Skype about HIPAA compliance because at the time doctors were Skyping with their patients having visits. And so we said, so, let's talk about HIPAA compliance. And they said, what's HIPAA? So that answered our question that they weren't HIPAA compliant. So we talk about these two columns here, this patient-empowered portal. And those are the places where we're going to start seeing healthcare organizations. They've got the electronic health record. It can't do it all. Health literacy rates mean the low health literacy rates that we have in this country mean that the EHR educational content is not going to be at the right level for the patient population that we're serving for the most part. And beyond that, I don't want to read through a bunch of long text. I want something more engaging. I want to see a video. I want to hear an audio. I want some other tools to teach me rather than having to read a bunch of text that's complicated on an EHR site. And then I want to be able to get into the social network that's part of that organization and have some experience. And I don't want to have to sign on a different site. So that's where the portal comes in. I go into my portal, I have my EHR stuff, I have my social networking opportunities, and anything else that needs to get plugged in. So this next slide is how we think about basically the care experience. It cuts across the continuum, and it was designed for, in general, healthcare, and I took it and turned it around into social media across the care continuum. And I'm going to give you two examples on the next slide, and one of them falls in that pre-treatment phase, and the second one falls in the post-treatment phase. But when we look at social media across the care continuum, it's important to have distinctions because not all patients are alike. Their experiences are not all alike. So the shopper, the worried well, I'm new to town, I'm considering maybe coming to this hospital or maybe that hospital. I go to Yelp, I check out the ratings, I look around. So there's information you can incorporate on your site to make it more engaging and friendly so that those shoppers decide that they want to choose your facility. Pre-treatment phase, there's a lot we can do to facilitate processes to make it easier for patients to get in the door. And we'll have an interactive learning example in a few minutes. Active treatment, journaling. We do fair amount of work with cancer centers Journaling is a wonderful tool for that patient population. Being able to, if I've got a tablet, if I've got a laptop, easily, I can type now. I used to be able to write, but now I can type faster than I can write. It's harder for me to think and write, but I can think and type much easier. So I'm probably not alone, and other individuals are probably preferring journaling on a blog rather than on a piece of paper. And then post-treatment, and the example I'll give is social support and networking example. Before I go on, though, I want to mention an experience I had this week with a client site. I was talking with a social worker, and she was telling me about all the wonderful things they do for patient-centered care and improving the patient's experience, and also the importance of the caregiver. So I am a big proponent of you educate the patient, but you also educate their family caregiver, because chances are the patient's going to forget and somebody's going to be there to need to help them. And the comment that she made was when I asked her about if they had ever started thinking about social networking. And she said, we have. She says, we have these wonderful support groups for the caregivers, but when the patients are in the facility, they don't want to leave the patient's side. So we can't get them to come to the support groups because they don't want to leave the patient's side. When they're at home with the patient, they don't want to leave the patient alone, so they don't come to the support groups. So they're looking at these social technologies as a way of facilitating a support group environment, but in a way that the caregiver doesn't need to leave the patient's side. So here are my two examples. The first one is fairly straightforward, fairly easy. Floyd Medical Center is in Georgia, and they put their perioperative guide on YouTube. There's also, you can click on it on their website, but they also have it on YouTube. So here's an instruction that sometimes you only get it verbally. The nurse calls you at home, gives you the information. By the time you're supposed to start getting ready, you've forgotten. You don't remember. I had a nurse at another client site who is a highly skilled nurse, but she's also a mom. So when she was getting her child ready for surgery, she was panicking that she wasn't remembering the instructions correctly. And she had nothing to reference back to at 8 o'clock at night. So they've got the perioperative guide on YouTube, or you can go to their website. You can go through the whole process. It explains everything. I don't have to read a bunch of text. There's graphics. There's a person explaining everything. That's a fairly straightforward of taking what is a historically sort of operational process that we needed to accomplish with patients and making it a much more engaging kind of presentation. And the second one is a social networking platform that I really like. And it started with recovering or individuals recovering from addiction. So it's a social networking platform. It's secure. It was created by an organization here in California. So of course it meets all the California privacy requirements. Individuals who are part of this are typically referred by their insurance plan, and it's part of their aftercare program, or they're referred by hospitals. So they also have some hospitals who have worked out arrangements with them to handle that aftercare component. But they're getting some really great outcomes. And the best outcome that they're getting is they're showing a significant drop in the number of relapses and readmissions of those individuals who are trying to recover from addiction. And those of us who've had some experience in the behavioral health world know that the addictive diseases automatically have high relapse rates. So to see something where there's been some improvement is really exciting. And then there's an app. So I travel a fair amount for work. If I were using this platform, I've got an app that I can connect with others no matter where I am. I can find a AA group in wherever I am, look it up. So there's a lot of opportunities for bringing this information to people where they need it. And this particular organization is now getting ready to expand. And so they've changed their name, and it's much more of a healthcare focus. And they are working with diabetes, so taking the same kind of platform and then shifting it over to think through how do we support individuals who are trying to manage their diabetes. And I heard someone once say that when they received the diagnosis of diabetes, they didn't know it was going to be a full-time job. But it really kind of is a full-time job. So how do we help facilitate some of these processes? And that's, I think, all I was going to say. So thank you.
Thank you, Christina.
All right, so it's great to be here, and my name is Joakim. Just a quick bio. I'm a physician by training, although I no longer practice medicine. I actually studied engineering at MIT, and then after undergrad went right into medical school, and then found myself more interested in public health and business in the world of health IT. And so I actually am the president of a medical education company called MCM, and I've been in that position now, or in that company for the last 7 years. And outside of working in medical education and continuing education for doctors and nurses and pharmacists, also enjoy speaking about social media and getting involved in things related to mobile health technologies and some startups there. So it's a really exciting time to be in healthcare. And I noticed that everyone's hand went up, or almost everyone's, when the Twitter question came up, but I saw that no one has sent out a tweet regarding the hashtag or being here in this session. And there's sort of two schools of thought. I've actually seen some lecturers and professors coming up and actually ridiculing attendees sitting in the room. How dare you pull out your mobile device when someone's giving a talk? You should be respectful and paying attention. But yet there's this other side of the coin, if you will, where people feel that by sending out a tweet or by engaging non-attendees, the remote audience, if you will, and broadcasting what's happening, that's valuable too. So depending on your level of social media engagement, be ready for both sides of that coin. So, as a physician, I bring in that perspective, that healthcare provider perspective, and I think for a long time, many people wondered, are doctors or nurses, are they even using social media? And there's a platform called QuantiaMD, which I'll talk about in a minute, as well as a Care Continuum Alliance that did this study in 2011. And they found that roughly 30% are using professional physician communities primarily to learn and to network with other peers and colleagues. And so this is beyond just socializing, this is beyond just them complaining about politics or healthcare policy and reform, but really at that clinical level and making it very meaningful. We're also seeing social media uptake in certain specialty areas, and oncology being one of those real primary areas, because if you think about cancer and off-label use and new science and emerging therapies, it's an area where there's a lot of information that's just pouring out of a fire hydrant. And if you're a community-based oncologist, it's difficult to keep up with all of that information. So that's one of the key areas where we're seeing social media really getting some significant uptake. And then, of course, we see hospitals and health systems using social media as a marketing tool. If you're doing something for the very first time, whether it's a face transplant or a double hand transplant, you want to let the world know not only that your center has the ability to do those things, but that these kinds of procedures are actually possible. So here's a snapshot of some of the medical communities that are primarily reserved for healthcare professionals. Some of these are international, others are just for US-based. Some are just for doctors, some may be for prescribers, so doctors, nurse practitioners, physician assistants, and then others are kind of a conglomerate or a mixture, with some of these being led by specialty societies like the American Heart Association or ASCO, which is a cancer organization. So let's talk about a few of these. CIRMO, which came around in 2007, really started out as a forum with the idea that physicians who are US-based would log on with a username. So everyone was anonymous on CIRMO, and everyone still remains anonymous. CIRMO has undergone some changes, they've been acquired, and they're continuing to go through some changes. But what's very interesting here is that there is significant activity, not all of it is clinical discussions, but if you post something on CIRMO, it will get seen, and people will certainly respond to it. And then about a year or two later, this other platform, which had been around for a while, called QuantiaMD, emerged out of the greater Boston area. And unlike CIRMO, the difference here was that they were primarily pushing content, educational content to doctors, residents, nurse practitioners, physician assistants, and others. And within that content, they were also creating these communities. So once again, you saw communities popping up, for instance, around emergency medicine or around psychiatry or around primary care and family medicine and so forth, with a lot of great content, but also the ability to have discussions once you actually consume that content. And most recently, the third one is called Doximity, and this one was actually co-founded by the former co-founder and president of Hippocrates. I'm sorry, it was founded by the co-founder of Hippocrates, Jeff Tangy. And they've actually now on the board gotten leadership from LinkedIn. And Doximity in many ways is like the LinkedIn for doctors. It's the professional network, if you will, where doctors are not anonymous. They put their actual photo, and when you click on them, you can see their full bio, where they went to school, where they did their training. So it's a very, very different environment. And here, once again, you're actually seeing clinical dialogues and discussions occurring. And what's nice about all of these communities is that you get physicians from all over the country. And I think most of us know that when it comes to patterns of care and the way diseases are treated, there are regional and geographic differences. So for instance, the way breast cancer is treated in the South is different from how it's treated in the Northeast, and it's different from how it's treated in California. And there are many reasons that sort of, in terms of the explanation as to why are there these geographic trends and patterns of care, but that is one of the things that's, I think, interesting when you start having these discussions online with a national group of people within your specialty, is you can then start asking, why do those regional trends occur? And that's interesting. That's how you do it there. Well, this is how we do it here. And so you can have those kinds of, some of those interactions. So here's an example of something that was posted on Sermo. And this is a classic example of how a community-based doctor who isn't part of a large tertiary care or academic medical center may use one of these networks. He or she may see an unusual rash. Patient comes in with fever. You're not really sure what you're dealing with. So you can either say, all right, well, I want you to go see this specialist and come back to me 3 weeks later. Or you can take a photo and say, is it okay if I share this with a network of other physician colleagues? And within a matter of a day, you have 17 comments from dermatologists. So in this case, this is posted by a primary care doc. And you have 4 different dermatologists all sort of chiming in. And they don't just chime in and then just leave. They actually chime in, see what other people say, and they react to those comments. So it's an interesting way where you're blending, in some ways, telemedicine with the sort of asynchronous communication with a community where you know that everything is secure and encrypted, and where you know that everyone who's come in has also gone through a validated process to be verified that they're actually a physician. So that's an example of how some of these kinds of things are happening. There are other examples of care coordination occurring as well. And what I wanted to mention in terms of the differences on Doximity is that on Sermo, you see usernames. You don't really know who those people are. It's kind of self-designated, if you will. On Doximity, you can actually see who it is and then trace back to see, are there actually regional differences that may explain the responses? And then later, if you want to pick up the phone and actually call that person and say, hey, is it okay if I send my patient to you? You actually have that opportunity as well. So beyond the branded, if you will, social media platforms, there are also enterprise-level platforms, Yammer being one. It was acquired by Microsoft last year. And there are a number of hospitals and health systems using this within their intranet to create communities where doctors and nurses and administrators can collaborate. They can work on projects, and then they can keep updated. And I think most of us probably all have a smartphone or some kind of a device like that. And in the same way that happens in the healthcare setting, but the difference is that you and I, if you're a business person, we work by email largely. You know, we send a lot of communication around by email. Well, standard email isn't encrypted. It's not secure. So you can't really have doctors sharing patient files and records via standard email. So imagine trying to do your work without email. I mean, how difficult would that be? And so hospital administrators and clinicians are expected to work without some basic tools that you and I may take for granted. And these kinds of social platforms not only foster a community of care collaboration, but real efficiency. So in the same way that you and I probably check email at night and on the weekends, doctors, even if they're not on call, they may go home, they may log on, they may check to see what the progress is like. And this is just, these are some examples of the kind of efficiencies you can achieve if you're a hospital or health system using these kinds of tools, knowing that your clinicians can access the information when they're not on site and still continue to move those projects through. So whether it's care collaboration, whether it's patient-related projects, whether it's initiatives such as quality improvement or patient safety initiatives that you may have within your own hospital or health system. These are tools and platforms that are providing the means to let that happen. And I think many of us, like I said, may take these for granted, but because of the HIPAA regulations, they're not quite as easily accessible within the healthcare environment.